Hello, my name is Angela Thoresen, and I'm going to be talking a little bit about what cystic fibrosis is. So this photo down here just shows normal lungs versus cystic fibrosis lungs. As you can see, all these pockets that hold the mucus in the cystic fibrosis lungs are significantly larger than the ones in the normal lungs. What is cystic fibrosis? Cystic fibrosis is a genetic disease that causes lung infections and can make it hard to breathe over time. The disease causes a buildup of mucus in the lungs, which causes damage to the lungs, and respiratory problems can occur as well. The mucus buildup in the lungs can harden if it isn't treated. This photo over here just shows the likelihood that two parents who carry the cystic fibrosis gene will have a child that has cystic fibrosis, a child that carries cystic fibrosis, and the child that is uninfected. How is it treated? Those who have cystic fibrosis must take a pancreatic enzyme with their food as an enzyme replacement. The enzyme must be taken before, during, or 15 minutes after the cystic fibrosis patient eats anything that contains fat. The buildup of mucus keeps the enzyme in the pancreas that breaks down nutrients from food from working like it needs to, and these enzymes actually come from a pig's gut. A little fun fact about that is that if the pig has a disease, then the person who is taking the enzyme from that pig can also catch that disease. How did I discover cystic fibrosis? Well, my cousin Joanna was diagnosed with cystic fibrosis when she was only a few weeks old. She was tested for CF right after she was born and started showing symptoms when she was only a couple weeks old. Her symptoms included wanting to nurse every 30 to 45 minutes because her body wasn't absorbing the nutrients she needed. Her stool was green with mucus and had a very potent smell, and her diaper needed changed more than normal. Her skin was salty and her mucus was very thick. One of the nurses in the delivery room actually said her mucus looked like cottage cheese. Joanna also had some minor breathing issues after delivery. This photo on the left is Joanna sitting in her car seat, and there's a little warning tag on her car seat just to let people know that if they come near her and they're sick, it could be really detrimental to her health. Joanna's treatments. When she was an infant, she started off needing an albuterol treatment first, 2 to 4 times a day. Albuterol is a solution that is inhaled by the mouth using a nebulizer machine, which turns the medication into a mist. Then her mother would sit on an exercise ball and bounce Joanna to break up the mucus in her lungs. When Joanna was 6 months old, her parents had to start doing CPTs, which is a chest percussion therapy that is done by patting the baby on the 5 lobes of the lungs. These include the chest, the back, and the sides, followed by the albuterol treatment. This photo on the right is her mother doing the CPTs to Joanna, and the two photos on the bottom are her using the nebulizer treatment. Then when she was 14 months old, she received her vest airway clearance system. It is a vest that is hooked up to a machine that acts as a way to break up the mucus in the lungs by vibrating. Currently, Joanna needs the albuterol treatment followed by 30 minutes of her vest twice a day, or up to 4 times a day if she is sick. The photo on the right is her using the vest, and you can see it's hooked to the machine right behind her. And these two other photos are her brothers helping her with the nebulizer treatment. And here's a couple of videos of Joanna. This one on the left, using the vest. And as you can see, it just vibrates to break up the mucus in her lungs. And then on the right is her using the nebulizer. You can kind of see the mist coming out of it. So here's just a couple more photos of Joanna. And this photo on the left is her wearing her mask, and she has to wear that when she goes out in public places with large crowds of people or during cold or flu season. And this mask is thicker than masks that you would get in a doctor's office, so it keeps her from getting sick. And the photo right next to that is just the machines that she has to use. So the one on the bottom is for the vest, and the vest is in the middle row right there. And you just hook it to the little tubes and turn it on, and it vibrates. And then the little green machine on the middle row is the nebulizer. And then this third photo over here is Joanna getting x-rays done on her chest when she was a baby. And they do this every once in a while just to see how much mucus is in your lungs, just to check on that. And then the last photo down here is the first time Joanna used her nebulizer, and she actually had staph growing in her lungs during this point, so she had to use that a lot. Where did cystic fibrosis originate? CF was distinguished from celiac disease and then became a pathogenic diagnosis. The life expectancy was only 6 months in 1938, and death was from lung infections. Then in 1959, sweat tests came about, which helped diagnose mild cases of cystic fibrosis. And a sweat test is a test that shows the normality or abnormality of the sweat chloride production in the body, and the sweat test is actually what Joanna had done when she was a few weeks old, and that is what confirmed that she had cystic fibrosis. And currently the lifespan for someone who has cystic fibrosis is about 40 years, so it has grown rapidly since 1938. Lung transplants. Most people with cystic fibrosis need a lung transplant by the time they reach their mid-20s. Exercise is especially important for those with CF because it can slow down the rate of lung infections, which means a lung transplant may not be needed for longer. All cystic fibrosis patients end up needing a transplant at some point in their life, but exercise just helps to go longer without needing one. And this blue photo down here shows healthy lungs versus cystic fibrosis lungs, and it shows the airway walls right below that. And as you can see, the mucus in the airway wall in the lung of cystic fibrosis is way thicker than the one in a normal lung. And then on the right is just a couple of x-rays, and the healthy lung, as you can see, is very clear, and the cystic fibrosis lung is full of mucus. What causes cystic fibrosis? Cystic fibrosis is a recessive disease that is only found in those whose parents both carry the specific gene, and CF only occurs in approximately 30,000 people in the US, so it is not that many. So this photo is like the one I showed before, with the two parents who are just carriers and the likelihood that their children will carry, or not carry or have the cystic fibrosis gene. So there's a 50% chance that their child will be a carrier, 25% chance that their child will not have the cystic fibrosis gene, and then a 25% chance that the child will have cystic fibrosis. And then on the right is just a Punnett square that basically shows you this picture of the parents over here. How much does it cost to have cystic fibrosis? Many receive Medicaid to help pay for the equipment and medications for those who have cystic fibrosis, and on average, those who have cystic fibrosis but do not qualify for financial help end up spending somewhere close to $300,000 in their lifetime for treatments, medications, and machines. This is just an average, so many will spend over that and many will spend under that. It really just varies depending on the case. And then finally, to conclude everything, I had no idea what cystic fibrosis was until my cousin Joanna was diagnosed with it. A healthy lifestyle is especially important for those with CF. Over the span of 80 years, cystic fibrosis treatments and medications have come a long way. Lung transplants are very common for those in their mid-20s. Cystic fibrosis is a genetic disease, and having cystic fibrosis can become very expensive if you are unable to get financial help. Thank you.